6-year-old male, known case of wet RMD, already on injection eccentric and 2 injection taken, but due to lockdown last year, he could not present for the loading dose third injection and presented directly after 8 months with, my slides are not changing. Yeah. So he presented with recurrence of CNVM, type 2 CNVM classic with a lot of intraretinal fluid. And at this time, we offered this new molecule to the patient, and immediately after 1 week, the fluid dries up, and visual acuity also started improving, which was remained dried at 8 weeks. And on OCTA, it was showing nice choroidal vascular network, which started regressing itself at the end of 1 week and further regressed at 8 weeks. And at the end of 12 week of first injection, on clinically looks more drier and regressed membrane, but on OCT showed recurrence of intraretinal fluid. And OCTA is also showing reactivation of this membrane. This is the serial images of OCTA showing reappearance of this membrane at the end of 12 week, and second injection was given. And after 4 weeks of second injection, again that dried up, and this membrane on OCTA also showing regression. Now case 2 is again other eye of previous case only. He started with bilateral wet ARMD with similar history, and there was a recurrence of this type 2 classic choroidal membrane after 8 months. And in this eye also, after brolucizumab, the intraretinal fluid and membrane started regressing immediately after 1 week, which was still dry at the end of 8 weeks. And OCTA is showing the regression of this membrane nicely, and at the end of 8 weeks, almost disappearance of this membrane on OCTA. But with similar history at 12 weeks, the reappearance of SRF and reappearance of this membrane on OCTA, and second injection was given at the end of 12 weeks. And again, after 4 weeks of second injection, this membrane again disappeared on OCTA, and patient is under follow-up. My case 3 is a male 35-year-old presented with metamorphosia since last 4 months, and to have history of CSR, and he was on some eye drops treatment elsewhere. Fundus photo showed RP mottling and resolved CSR like picture, but on OCTA it showed choroidal neovascular membrane. So the diagnosis was made of chronic CSR with CNVM, and at that time injection eccentrics was given, and at the end of 4 weeks the PD had regressed, fluid also disappeared. Symptomatically patient was better, but this membrane was lying as it is on OCTA. We asked patient to complete the loading dose of eccentrics, but at that time patient refused for the treatment, and then he came back after 2 months with further increase in his symptoms, and at this time we injected brolucizumab. And the more interesting one is the PD got flat, and this choroidal neovascular membrane disappeared on OCTA, and which was maintained even at the end of 6 weeks, and he is maintaining 6/6 vision. My case 4 is a female 80-year, known case of wet ARMD, one-eyed, other eye lost with disciform scar. Already patient had taken eccentrics and aflibercept, and presented with large fibrovascular PVD with lot of intraretinal, subretinal, and sub-RP fluid. And after the 1 week of brolucizumab, the whole fluid disappeared, but the height of PD increased. And I was a bit worried about having a RP rip in the follow-up. But to my surprise, at the end of 4 weeks, this PD got flattened, and patient's visual acuity improved from 618 to 612, one line. And serial follow-up is showing at 8 week, at 12 week, flat PD, no intraretinal fluid, but reappearance of fluid at the end of 16 week, and second injection of Paginex was given at the end of 16 week. And again, 4 week follow-up, it's flat and dry at 8 week. Again, at 16 week, the recurrence of fluid and second injection of brolucizumab was given at the end of 16 week. Now, case Next case, male 74-year-old presented with just metamorphosia since 1 month with visual acuity of 612, treatment naive patient, and color fundus photographs showed a lot of exudation and subretinal hemorrhage inferior to macula. OCT is showed multiple PD with SRF, but fovea is relatively dry. That's why he was maintaining good vision. But at the end of 1 week, the fluid disappeared, but the height of PD increased. And at the end of 6 weeks, this PD height got flattened, all fluid disappeared, patient's vision improved to 6/6 part. And on follow-up, that maintained at dried at 10 weeks. But on OCTA, at presentation showed a lot of noise and some vascular activity on octa, and some vascular loop-like thing was observed. And at the end of 10 weeks, the octa showed more homogeneous and silent appearance with this loop got regressed on octa. But at the end of 14 weeks, the PD had started coming back, and second injection was given at the end of 14 weeks. And at the end of 8 weeks of second injection, the PD is maintained at the same level. Visual acuity is also maintained at same level. And this vascular loop, which was present, has again regressed at the end of 8 weeks. Now, I have a follow-up of second week, 16 week second injection, and as well as just 3-4 days back, we completed 20-week follow-up of second injection, and still he is dry and a little bit PD, but no symptoms and visual acuity maintained. So it started with this PD, and I'll just skip my last case. Again, PCV case. So probably I was first to use this molecule in India after its commercial launch, and up till now I have used 60 patients, and no intraocular inflammation was observed.